We are here with Dr. Brunke. He was our vet back in Virginia, did all the work on Hurricane. I don't know if you saw some of our other videos, but he did the hip injections, the PRP, a bunch of different stuff. Really took care of Hurricane and his hips, and he's out in Denver doing a conference. So, of course, stop in Colorado Springs to say hi. So, Dr. Brunke, go ahead and introduce yourself, what you're up to lately with work, and also with Paul's of Honor.
Sure, it's really cool to be hanging out. I've missed you guys since you moved, so I had to come see it and actually see Hurricane. Like just get a chance to get see how he's moving around. It's cool that he's moving really well here and get a little more outdoor time, which is fun. I'm a veterinary rehab and sports medicine specialist. Was in Virginia. Actually just moved to VRA, Veterinary Referral Associates in Gaithersburg, Maryland. Just started that job. I'm really excited to be with that team. And everything I do in vet med is focused around mobility. So whether it's dogs, cats, I've done some anything that doesn't walk right, my job is to figure it out, and my team and I help them to feel better. Some things we can cure, some things we just manage, but we always do our best to try to improve upon it.
What are you doing with Paul's of Honor now? I heard your team joined their team, so
Yeah,
they snagged you before we could. So good on them.
it's all on a good team effort. I've done a lot of work with Positive Honor. I've been super impressed with them the last couple of years, and they asked me to jump on the board to provide, which is cool because I get to be the first veterinary specialist on that. So bring in some of my insight, my connections to what the bills that they're looking at for these dogs. Some of the bills are the routine care, and that's super important. The vaccines, the heart prevention, the day in, day out. But when we have retired canines going through major surgeries, cancer battles, things like that, my job, my contribution, my way to give back is to make sure that we're doing that the right way and helping those teams out.
Before we kick off, so I've lived in Virginia and Maryland, or Baltimore for a couple of years, and obviously bounce around Northern Virginia. Do you like it better, worse, different? It's to me, my answer was always it's just totally different. You think two states right there,
Mm-hmm.
the DMV would be similar, but yeah, it's like it's very very different.
It's different. I'm enjoying it though. I haven't been home much, or when I've been home, I've just been at the new job, so I haven't had a chance to explore that part of the Beltway yet. But I'm looking forward to it. Getting out with my own dogs, getting some hikes in.
Yeah, there's no shortage of that actually in the state. We did a ton of hikes in Virginia as well, but yeah, Maryland's got all kinds of stuff. But when I lived in Maryland, I lived actually in Baltimore, like downtown. So no hiking there, but very cool scene. So thank you to everyone who submitted questions. We got way more than we will be able to do today, so we might have to do a part two or part three.
Yeah,
But thank you everyone for sending them in. So if you're good, I'm going to kick them right off and
is that
we'll
it?
get rolling. So the most interesting injuries that you have ever had a canine be able to return back to work?
All right, so I'm going to lead off with the more common injury, but it's because it was super cool. Dogs can tear their ACLs just like people can. It's actually one of the most common injuries we see in all of vet med, and a lot of units will always take. All units will always take care of their canines, but sometimes they would repair it and medically retire the dog. What we've known over the last couple of years is the technology's gotten better, the team and the rehab recovery's gotten better. Most of the time, we can take these canines and not only repair them, but return them safely and comfortably to active duty. And that's really important because some of these dogs are tearing their knee, at age 4, and they're not ready to be home in
We
retirement.
had several that happened in the rehab processes. What kind of timeline comes with that?
From surgery to recertification is probably going to be, depending on the canine and their job, about 10 to 14 weeks. So just right around 3 months. But that means we can, like I have canines that we've returned to explosives, patrol, long distance tracking. So there's not a limit here, whether it's Beagle Brigade or Bloodhounds or the Malinois and the Dutchies taking bites. We can have a good chance to get them back doing it. So that's the most common one. But one of the most interesting ones is dogs that have had a number of these where they stretch out their wrist, they land, they take a jump wrong, something happens, and they really overextend their wrist. And if it's like us rolling our ankle, that can be really tough. It's a very complex joint. And if there's not a blatant tear of a ligament that a surgeon can put back together, a lot of the times it's trying to, we have a battle with them because sometimes their dog has to have their wrist fused surgically.
Yeah.
Like if they break it really badly, if that's to that level, they'll fuse it and then that dog's retired.
Well, because I guess it can't bend, it has no mobility.
Right. So if it's, but what we've been able to do, what I've done with a number of dogs is we'll do all the testing we need to, so an MRI or an ultrasound, see how much the tears are, and then I can inject stem cells and platelet-rich plasma,
Okay.
PRP, into that, and we put them into a custom space boot, and we get them through again like a 3-month process. But we've done that with a handful of dogs, and we've gotten them back to full deployment within like 4 months. So
What's the
that's my
stem?
favorite.
What's the stem part? We've never done that. I don't think
Yeah,
we have.
we haven't had to do that with Hurricane. What we do, so platelet-rich plasma, we take their own blood and we separate it out, get just the platelets. That's great as an anti-inflammatory, reduces the pain and the swelling. But if we have tears in a ligament, like there's gaps in it, then we need to put the stem cells in those gaps so that it can start to knit back together. So we'll use those to help stimulate the body. But this is not magic. But what they do is they recruit the body's other stem cells and signal that healing so that it can repair that torn ligament.
Okay. Okay. So that wouldn't. Hurricane didn't necessarily have an injury, but he just old and fatigue. But that so that wouldn't be applicable to what.
Some now with him, we went with the hydrogels like Arthrimid is what we put into his hips earlier this year so that he would be more comfortable. And we'll talk a little bit more about like the epidural injections we did with cortisone we did with him too for his sciatica. I think that's one of the other questions he's had. So,
All right, we'll go next one. What is the most common mobility problem you treat in retired working canines?
all right. So in retired canines, the selection process has gotten so good with these dogs in the last decade that we're having less problems with hip dysplasia, but that's still one. But the biggest one we battle is what's called lumbosacral disease or LS disease. And it's like sciatica in people, it's low back pain. It's the number one reason why DOD in the States, Israel, New Zealand, Germany retires any operational canine early. So that's our biggest one. And it's a tough one, but we've gotten a lot better with managing that. I even had some canines in the last couple of years that we've been able to return to active deployment in their job by managing it. Just like us, we can manage our low back pain. Um, and then the ones that are retired, that's a lot what we do with Paws of Honor, is we'll do a series of epidural steroids. So we'll anesthetize the dogs. We see it on an MRI, but most of those are not surgical. If we can inject the epidural area with cortisone, takes the swelling out of the nerves, gets their back pain resolved, and then we can get them into PT, rehab, and strengthen those muscles like we did with Hurricane.
So then what, obviously with a person, low back pains from improper lifting, things like that, with how does what do you think the main cause is of the lower back pain, or is it hereditary?
I think it's a combo, right? So the number one breeds that we see it in are the German Shepherds, some of the Mals, but the Labradors are there too. But we even see it in Greyhounds and Great Danes. So there's some genetic component that we haven't identified yet, but there's also, it's with us, it's like improper lifting. Some of these dogs, if they have a real hard time when they're hupping, right? If they're hupping constantly, and again, doing it with the right form is really important and the right structure. Some of those dogs wear out their low back a little bit sooner, and it starts to bug them because it's a chronic repetitive stress back. But there's ways to look at it. Like we can screen them, like we can do hip dysplasia X-rays, pen hip, but we can measure the amount of laxity in their hip. We also can take X-rays and look at their low back vertebrae and see that the form and the structure of those is good. And that's an important thing for me. Like if I'm looking at an acquirement exam on a canine potential, I want to see that their vertebrae and their spine are looking pretty normal because we want to set that dog up for success.
And you've done that with me, where we've went through and looked and pretty much broke down. Look at the gap here, look at the lack of cartilage here, and kind of go through. Yep. All right, that makes sense. Next question. I get this one all the time, and I do not know that you have a lot of controversy around it. The CBD and all those types of products for dogs. People absolutely swear by them, and people are absolutely set against them.
It's a tough spot, and we're going to have to keep learning on it. So the thing is, there's one company out of Maine that's made a joint. It's essentially a supplement. All right, so let's back this up. CBDs are like joint supplements in that there's no federal regulation on them in the U.S. So unlike food and drug for big pharma, right? That's covered. There's an inspection process. It's validated. There's no regulation like that for CBDs or for joint supplements. So we got to be careful because we just have to. There was one study out of Cornell's vet school that looked at one specific type of joint of CBDs for joints for OA and showed some pretty good results. But just because that company makes it one way, all these other companies that are out there could make it different.
And there's tons.
And there's a lot. It's the hot topic. I want to see more research. My colleagues, I know a couple of my colleagues are actively researching other CBDs, but Cornell even looked at, like they took 15, I think, joint specific CBDs just off the shelf, and they ran them through their lab and they analyzed them. And some of them had no CBDs at all. Some of them had THC, right? The active, like we didn't want that to hurt
No.
And
especially not over giving that to your dog every day.
Right, we don't want to get them wasted, right? And then even there's a handful of them that had toxic metals in them. So if you're getting a CBD supplement for your dog, the best thing I can tell you, you have to ask that company for what's called a certificate of conformance. And that is an independent lab has analyzed their product and they should be able to show you, hey, this is what's in our stuff. Ask for that, and then I ask, what's your research to support its use? Because the doses are all over the place too.
And then everyone who asks me, I'm just like, oh, out of curiosity, what's the issue with it? And it's always different. So it's like, what would be the main, in theory, if you had a perfect CBD supplement for a dog, what dog would be a good candidate? In theory, if it works as it should.
If it works as it should, I'd love it to help support arthritis pain, because that's my area. Now, my dermatology friends would probably see if it would help there. My neurologist colleagues, right, they're looking at a couple of different CBDs in different doses to help battle epilepsy. Okay. So we'll know more in a couple of years, but it's a little scattered right now.
So for right now, it's new. We need to learn more about it.
Just be safe. That's the biggest thing.
Right, next question. Thoughts on acupuncture for arthritis at home or massage techniques for your dog?
I love acupuncture. I got certified in almost 10 years ago.
I didn't know that.
I don't use it as much because usually my team, I have somebody else that can do it, so I can focus on the joint injections and the arthroscopy stuff. But I appreciate it. I've had it done to myself, and it can help. It helps, for sure. I actually like it. I have a couple of colleagues in the Maryland area that are veterinarians that do house call acupuncture. So I like them to do in this quietness of their own house. It's a little more zen, so dogs don't get stressed out. But there's been really good studies in vet med looking at acupuncture to help dogs especially with herniated discs. So like dogs that blow out their back, like dachshunds, the French bulldogs, we can aid that in their recovery with acupuncture.
Okay, and then the massage. We've met a bunch of massage therapists over the years for canines. I do it, especially with his hips. I don't know. I feel breaking up lactic acid or whatever's building up in there, and he just likes it. But yeah, I mean, do you think that those? I do it, specifically on his basically where the injections that you give him are. I kind of just move it down there, and then I know it works because if I hit the wrong spot on his spine, he does give a jump. So I'm like, all right, there's obviously something there, and then I back off and then just try and lightly, work it out or whatever. But do you think that works? Is that something?
Absolutely, right? Like I like the rehab professionals to do it first. We know what we're dealing with because we don't want to do any harm to them first. And then it's important. You should ask your rehab professionals, hey, how can I learn a little bit about this? Can I do it at home? Everybody loves massage, right? It can totally help. We just want to do it the right way. I actually did a piece a couple of years ago because they asked me, like, could you use a massage gun, right? Like these massage guns?
We have one of those. Yeah,
right.
They're all
safely. Yes, on the lowest setting. Right, like, you got to be super careful because, like, you may like a big deep tissue massage. Remember, if you have a Chihuahua or even a Labrador or a Malinois, like
you could break a rib or something.
Exactly. Yeah, you got to be really, really careful.
Well, and if the dog turns around and bites you, you're probably too
That's
hard.
the yeah. You got to be super light, but when in doubt, pet your dog,
Yeah.
right? Like
Well,
myself.
that was my theory on it. I'm like, whether this is doing something or not, he loves it.
But
So
it is doing. It's something doing. It's a on time activity, right? Like I have two rules for your dogs, right? Walk your dog every day and pet your dog. Otherwise, why do you have a dog?
exactly. Well, we'll get into that too
Yeah.
because there was some other questions that I remember seeing. So next one, do you prefer TPLO, TTA, or what's this extra-capsular repair for torn ACL? I'm
Right.
not familiar with any of these terms.
So those are three main ways to fix a dog's knee that's torn their ACL. Okay. I'm not a surgeon. Back when I did primary care, I used to do those surgeries, and I like them all. I think that in the right hands with the right surgeon, they all can have good successes. The research that we have the most on is the TPLO procedure. And that's the one that I have the most experience and confidence in for my working canines to get back to job. But I think in the right situations, depending on the chihuahua or what's going on, just got to get a good informed way to fix it. The extra-capsular repair came around first. That is like taking a knee brace inside the knee. So it takes like take a fake ACL, take a synthetic piece of suture, and you put it inside the knee so it gives the stability. Like with us, we wear a knee brace.
Yeah.
Knee braces in dogs, the research is really poor. So that's not my way to go for. But the extra-capsular repair puts it up, so that's really good. It takes it and puts it inside the knee. But the TPLO, what it does is it eliminates the need for the ACL, right? Because if this is your tibia and this is your femur, right? Not to be rude, Marshall, that's your ACL, okay? And when the knee bends, right, the job of the ACL is that when I plant my knee, it doesn't buckle, right? When your ACL is torn, your knee's buckling. So when they take that step, it's going forward.
Yeah.
But the dog's top of their tibia is angled, right? So if we cut through with a bone saw, right, we rotate it, the metal plate screws here. Now it's flat. And now when they plant their foot, there's nowhere for that to rock, to roll.
And you can, so I know when you felt Piper, and I've seen you do it with some other dogs. You can feel it within seconds and diagnose. And what are you feeling for when you're manipulating that? Like, can you actually feel it separating?
Yeah. So and like I have done it for a long time now.
I've
So
never seen something diagnosed so quick. Like it takes seconds.
if the dog's calm and it's and you know what's going on and you've done it a lot, but it's a skill.
Yeah.
I've done this now for almost 20 years, so I hopefully I'm good at it at this point. But what I'm feeling for is that instability. So I'm just trying to see when there is it completely unstable or is it just partially torn? At least I can get an idea. But even in my hands, like there's some that I'm like, I don't think it's torn. And it doesn't matter if it's a Chihuahua already up to a Great Dane. There's some that we have to sedate because the dog is just so tense and uncomfortable. So we'll sedate them and I'm like, oh, I don't think that's torn. Maybe we can just inject it. And we'll sedate them and I'm like, this thing's flopping. Like, we got to
So
get
they're
it together.
tensing up and almost.
And that's interesting in my experience. There's actually 2 research studies on that proving that in dogs.
Very interesting. Next question. Are there any supplements or injections you can give post-surgery to speed up recovery? I know people ask this all the time about themselves, but we'll stick with dogs today.
Right. Let's stick to dogs. Yeah. I am not a human doctor. Yeah. There's not a lot, right? It depends on what you're talking about, aiding recovery. If we're talking about in our world, my world with like orthopedic surgery, or even like spinal surgery, those are things I spend the most time on with those. There's a new supplement out called Myos. Don't get any kickbacks from or anything like that. They've got some research coming out that they can actually help in the muscle belly recovery. So the muscle fibers themselves, strengthening those. It's a supplement called Fortitropin. So that can help to stimulate some muscle healing and some muscle development. It's early, it's new, but I've used it in a couple of dogs and it seems to be a good option. But the other ones in speeding up the recovery is giving them time, right? So just not letting them chew at their incision, following the rules. Veterinarians, vet techs, we all care about the animals. We're not out here to be mean and be like, you have to walk your dog on a leash for 8 weeks because we're out here to be cruel. We want them to walk on a leash so that the body has the time to heal. And then feeding them good food, right? And not letting them be fat. Like if you go into orthopedic surgery and you have to wait a while, right? That's the time to like, your dog's chubby.
Yeah.
Let's dial this back a little bit so that they're not putting too much weight on it while they're recovering.
Okay, so that leads into the next question, which you and me talk about this all the time, and I have my personal opinions on it. But how do you avoid injuries in your dogs? The injury prevention, blah, blah, blah. I mean, to me, it's like, what would you do? What do you do with yourself? You stay healthy, you stay active. I
Right.
mean, it's the same thing for dogs, I'm guessing, right?
It is. There's no magic. I wish there was a magic answer. There's four big things that I think about. Number one, like I said, stay lean, right? Dogs we usually grade on a scale from 1 to 9. Okay. One's a walking skeleton. We don't want that. Nine's a walking watermelon. That's not healthy either. We want them to be a 5. It's right in the middle. And even for working canines, there's some research that we should probably leaning them more towards a 4. So they stay just really lean and fit. That's the biggest thing because when you go from a 5 to a 6, they're 10% overweight. So when you go from a 5 to a 9, the dog's 40% overweight. Right? That's if you're 100 pounds, that's you being 140. Right? That's way too much. So staying lean, super important. Everybody can check it at home. I'll show you a neat trick, right? Make a fist for me, right? Take your finger and rub it over your knuckles. That's what your dog's rib cage should feel like. Okay. If you can't feel that and you got to push in, we got to talk. Okay.
Well, so when we go to the doctor, obviously you got the chart. You're this tall. You should weigh this. But I have seen they do the I have pictures actually. Overweight, underweight, and it basically shows you should almost be able to lightly see the ribs, but not see bare bones. But I guess it depends on the breed too, right? So it can't. That scale is fine for humans, but for dogs, they're so different and they're built so different, and the different muscle. You have some of the pit bulls, rock solid, and other people. So
Right.
the weight you can't really judge a dog on its weight unless you're going breed specific.
We're trying to watch it, right? Like, so the rib cage, their belly fat, their back fat, we can get an idea, like in feeling the tops of their vertebrae. Yeah, like everybody has different body shapes and sizes, right? But you still can get a good idea of them, and you can even grade their muscle scoring too. We can see how much muscle they have. We can do all sorts of complex studies and big tests, but those we usually 99% of the time we don't do. But you can feel it and you can keep a good track of it. That's one key to avoiding injury. The second is getting good training, right? So with that, good training means like walking, not lunging, right? I'm not a big fan. Two things I don't like for dogs is those front no pull harnesses, because all I see is them bashing their shoulder tendons.
Yeah.
That doesn't help me. And flexi leads can go away, please.
Okay.
Okay. Dogs run out, they get injured, they get yanked to the end of it, right? So, but good.
And
solid.
I see dog every time I'm around dog and somebody has one of those. That's how the dog fights happen.
Right.
They have it and then it pulls or it gives out. And if you ever seen the inside of those, and most of them, it's just a little piece of plastic. It's holding that leash anyway. So I've seen those give out as well.
But train the dog to walk well with you, socialize them that they can be out in public, so that you have that good bond. So when you can touch your dog, right? And something's not right. You know your dog. Hurricane, you've been how many years together, right? You know when one fiber of him is out of whack.
Yep.
So stay lean, train and be bonded with your dog, and then, like I said, walk them every day. Okay, mostly helpful for us and for the dog. Right. And then the other one is core fitness, right? Like we all skip on yoga, right? We should be better about it, right? But we need
not a big stretcher.
No, right. I mean, I think you like to lift a little bit.
If I have extra 10 minutes, I'm just going to keep working.
Right. And I I run marathon, right? But I've trained my dog to run my marathon training runs with me. Right? But dogs are great about stretching. They're smart about it. But there's a really cool program that the Penn Vet Work Center in Philly, it's a fit to work program. And it's core exercises for dogs that you can teach your dog over the course of a couple of weeks. They're simple, they're straightforward, and it's a great way for you to bond with your dog and get your dog like rip shredded, like be in great shape.
So a debate we used to have all the time with the Secret Service canines is how those, especially the Malinois, the amount of exercise they need is crazy. Training weeks is good because it covers itself, but then the rest of the weeks in the month, we're doing multiple runs. I have to. Not anymore, but the debate we always had is some of the guys used to go on runs with their dogs. So you're kind of working out together and you are bonding as well. And then other guys were very set on running the dog as in throwing the Kong and just sprint. So just like, you have a sprinter with humans, you have a sprinter versus long distance. The vet that I talked to at the time about it, because we were going back and forth about it, they were saying that the sprinting is better for that type of dog because although the dog can go run 3-5 miles with you no problem, the impact on the joints over the long period of time, where they were saying 10 minutes of just sprinting back and forth is better. This was 10 years ago. I don't know if it's different now, but what are your thoughts on, not for a regular dog, so this will be specific. Regular dog, you walk them multiple times, take them on a run with you. But if you have a working dog and you're worried about the hips and the joints and all these things, but you also need to exercise the heck out of them, do you think the long run is better, or do you think the sprinting is better?
Both, and the core exercise. So you can ideally do all three phases in a workout week. So some slower tempo, medium distance runs. I'm not saying to go out and do 10 miles, but do 2 miles, 3 miles, something like that. Do some sprinting, but sprinting in a big space. If you're sprinting just in your backyard and they're going to slam on the brakes all the time, they're going to injure themselves. So sprinting in big space, absolutely. But then the core exercises too, because not only does the core exercises work on their muscles, but it mentally stimulates them. So it's a great way to get that dog tired, is to make them think. So I like all three. Mix them up a little bit differently. Dog doesn't get stuck on one thing. And we all know from the human side too, like we're sitting here in Colorado Springs, Olympic City for USA, right? Cross training. Use different muscles, different ways. That's a great way to stay at the top of your game as a canine.
Interesting. Yeah, it's usually the answer I get is real set one way or the other, but I did both.
Yeah.
So I loved the 5-mile run with Hurricane, where we're out at a park and just hiking or running together, and that's like a bonding thing, and that's good too. But on our breaks at work, we have half an hour, grab some food, and go and just pull over somewhere that we had like a private area. We used to the vice president's residence. There was always tons of places there where it's not open to the public, but there's obviously nobody walking around. But yeah, just 10 minutes throwing that con, getting that sprint in, and then on the weekends, or if we weren't working, I would do the long run. So, that's kind of what I did. So, in that regard, the next question, with hip dysplasia, is that possible to rehab or recover from that without surgery, or is surgery the only option?
It's never a black or white situation, right? We got to look at what the dog's job is and how impacted they are by their arthritis. Now, if we can screen them early, like we can, like the pen hip x-rays, I can screen a dog as early as 4 months old, and I can tell you what their hips are going to be like.
Okay.
So I like to screen early if we can. How affected are they? Right. But if we keep lean and we keep active, I have some dogs that have hip arthritis that continue to work full careers. So what's their dog's job? How do we keep them in shape? We can manage a lot of them. On the flip side, there are some cases that joint just wears out. And I'm lucky I don't do these myself. I have an awesome group of colleagues that do total hip replacements for dogs. We've done that now for quite some time. And we've returned a number of working canines back to duty with bionic hips.
Okay.
We've even got one in Virginia, Bloodhound, who went back to long distance tracking with bionic hip. So, but we manage it, right? Get a good team. The thing to do with those is get a good rehab professional to be your moderator. Your primary care veterinarians are awesome, but their job is the wellness. When you have a hip dysplasia thing, you got to be working with a rehab team to go, what do we need? Do we need injections? Do we need surgery? Do we need an underwater treadmill? Yeah. What are we going to put together for that dog?
So it's great. These questions all lead into each other. So the next one was about underwater treadmills. We've done that with Hurricane. The question was, I believe, does my dog actually have to be rehabbing to do the underwater treadmill? Or if I have access to that, is that something that I should do on my own just as preventative?
Well, so yeah, we can do it as a conditioning exercise, right? It's hard because with the volume of caseload a lot of places have right now, we have to prioritize it for the dogs that have back injuries or orthopedic issues. But I've used it on a bunch of working canines to burn that energy off, right? So we can, maybe I'll send a link to you. You can post it. I have my own dog. My pit bull Penny runs all my marathon training with me. I had her in an underwater treadmill at 9 miles an hour on a 15% incline with the water at her knees where it's the most resistance.
Okay.
She can hold that 9 mile an hour pushing through like the lazy river for 45 minutes and not be tired. So it's a great way to safely condition the dog. whether it's just the dog who maybe you can't take out in public. Right? There's some working canines that ain't going to happen. So you can use an underwater treadmill because when you use the resistance of the water, you can get a much more condensed workout in. It's still in a safe environment. So there's a lot of good rehab places you can do conditioning for sure.
I see Instagram videos all the time of people who just have crazy, crazy dogs with an exorbitant amount of energy, and they have them on treadmills, actual regular
Yeah,
treadmills, just in a harness, and they're just running like crazy. I mean, I always hope they're not overdoing it with the dog, but having a Malin while having a dog like that, I could definitely see if that's done properly and regulated, like leaving the dog on there for 3 hours and going in the other room watching TV. But for
no.
those dogs that just have to get that energy out, you don't live in an area or 3 feet of snow or whatever it is, you can use that. But have you seen those? I mean, what are your thoughts
I've
when you
seen
see
them
that?
and I've prescribed it. I've asked
Okay.
owners too, because like I've pet parents or handlers. I'm like, look, your schedule and mine don't overlap. Do you have a treadmill at home? How big is your dog? Right? Like my beagles, my smaller dogs, most of those are going to fit on a standard human treadmill. But you can also get canine specific ones with a longer belt. If you can get like some of the tread ones, that's even better because then it's variable speed.
Yeah.
You don't want the hard impact. But again, you can use it. You have to be standing there or sitting in a chair right in front with the dog at all times. There's a zero. I have a zero tolerance on that. Right. All it takes is one step for that dog to get absolutely injured.
Yeah.
But you can make it a positive thing, get a good workout in. Absolutely can do it.
Yeah, I mean the videos. They come into the room and go set it up like the dog runs. So that at least makes me like that dog actually enjoys getting on that thing. It's always funny to look at.
Just don't feed them while they're doing it. Right? Like try to get them acclimated to it. But remember, like Grandma always told us, right? You don't swim and then you don't eat and then go swimming right away.
Because of bloat, right?
Right. We got to avoid any risk factors for bloat.
And can you explain what happens with bloat real quick? Because that's the number one injury that happens with the working canines. Even it's sometimes not even from food; it's just from too much water. And obviously, you're working all the time, so the instructors are crazy regulating on it, and we're on it all the time too. But it still happens occasionally. And then and this wasn't a, this is my question actually. Is I didn't get what's the surgery called for the bloat? It starts with
Gastropexy.
or gastropexy, yeah. So we didn't get that till actually after.
Mm-hmm.
What are your thoughts on that surgery for working dogs before, after, and explain what bloat or how the stomach works?
So let's start, right? Dogs have a stomach just like us. And we don't know what causes bloat, but what happens is it fills up with gas. And so sometimes it just fills up with gas, they're belching and burping. That's still not so helpful, right? And it can happen right after exercise. It can happen right after eating. We don't know, but that's why, like, if you walk or run your dog, let it cool down for like half hour, 40 minutes before you feed it.
Because I see that all the time with dogs dying from the long walk, and the first thing people want to do is give the dog a ton of water, and that can actually
Exactly.
be detrimental.
We don't want to do that. And then there's food bloat where they go in and feed into the food cabinet and eat all the food, and it's just that's a mess too. So those types, but the one where it fills up with gas, just like a big fermentation vat, and the danger happens when that stomach twists.
Because it pinches the sides correctly.
It blocks not only the stomach to the intestines, but then when it swings around, it puts enough pressure on the aorta and the vena cava. So now we can't get blood back to the heart. Now we're in crisis. Those dogs blow up. They look like a giant hot air balloon. They're trying to throw up and they can't. So if your canine is retching and is distended, you get to the ER now, period. Okay. But what we can do is we can decompress those, right? We have to go to surgery then.
Is it like a needle D?
It can be a needle D, absolutely.
Just
right?
like with people.
When we treat canine first aid for handlers, we teach all the handlers how to decompress their dogs because you never know.
In between the ribs, right? And the exact. I can't describe it, but if I have the dog here, I can do it.
You can do it.
And you put your fingers in, and just it's the same thing as a needle D, just like with a person.
Totally. And you're going to smell like a fermentation vat. Even if you decompress them, get into the right. You have to inspect the stomach and what's happening. But then once we empty everything, a gastropexy where we tack the stomach to the body wall so that it can't twist. Okay, they can still bloat, right? And they can still get gas, but then usually we can get a tube down and just siphon it off. But once they're pexied, they're not going to twist, which is huge. Now, in the working canine world, especially with a lot of the dogs being male, right? We don't want. Years ago, we used to have to go through their abdomen and make a big incision, which would take them out of work for a while. Now we have surgeons that can do it all laparoscopically.
Okay.
So it's an incision that big, right? So if we castrate a dog or we're doing it like if we have a female working dog, right, we can go in through a really small incision. We can do laparoscopic spays now.
Okay.
So you don't have this dog with a big incision. We can get them in, out. They're out. They're still on restricted activity for a week, but we can get them back to job and back to training faster. So I like laparoscopic work for that. And if we do stuff like that, we can get them going. Gastropexy as a preventative, I highly recommend for the working canines, except for the huge kennel situations. So there was a study by the Army Veterinary Corps down at Lackland where they looked at that, where some of the dogs, and that's a different kennel situation, right? Huge, huge operation where some of those dogs that had their stomach attacked started to spin their intestines instead.
Okay.
So that's still for the military to figure out, the Army Veterinary Corps to judge in on, but outside of that, gastropexies are a good thing to do.
Okay. So my take on it was that the dogs were getting surgery for something else.
Yeah.
And you could additionally do it. I feel like we were doing it, but I mean, obviously I didn't get it done until afterwards, but most of the working dog handlers I meet, the ones who sit, I ask if they've had it done and they said, well, I had this done and then that done also.
Yep, yep.
People or handlers typically don't do surgery just for that. And again, I'm talking some years ago, probably the recovery time. Now your dog, you get a working dog, you train it, now they're out a month or whatever. So I think people, handlers back, when I was doing it, were just doing it in those situations, but weren't making a special trip and a special surgery.
Exactly. But if you have a female working dog, right, most of those you're going to wind up getting spayed. That's an easy time while you're there. Other ones we play it by ear. But yeah, if we can conveniently do it at some point, it can be a lifesaver.
Okay. Next question. We got two more. Do you recommend Librela? Am I saying that right? When available in the U.S. for a 13-year-old hunting dog?
So Librela has the potential to be a really cool drug. It's dog specific. There is a cat version for you cat folks out there called Silencia. It's been in the UK and Europe and Canada for a little bit longer. Librela is not available yet in the US. It's a once a month injection under the skin. And what it does is it turns down the volume of the pain. So it blocks the dog's ability to make new nerve endings in painful joints. So it has great potential. It's just brand new. I haven't gotten to use it yet in dogs, but my Canadian and British colleagues have sent me back some pretty good results. So I think it would be a good thing to consider. But as part, like we don't have one magic thing, right? It's still going to be a multimodal approach. Get the dog lean, get the dog active. To help him get over the pain, it can help.
So if that isn't available in the U.S., when we're talking about CBD earlier, and there's not tests for that, but so that there is that because one's a medication and one's a supplement?
Exactly.
What's the difference in the process there?
Right. So what the company decides what it's going when they're going to take it. Is it something that qualifies as pharmaceutical? Then it has to go through FDA. Or if it's not, and FDA has very specific rules, what counts as pharmaceutical, and if it doesn't, it can either be like a supplement or like some of the things we inject into joints, which is my favorite thing. Like I like a targeted approach. Like why would I give systemic meds if I just have one bum or painful area, right? I can just put something right there. Some of those are called medical devices. So PRP, Arthramid, Synovitin, those are some of the things that I have tools in my toolbox, depending on what I need for each individual patient.
So this kind of doesn't make sense to me. How come medicines that you have to get prescribed by a doctor or vet anyway, have to go through so many tests, yet supplements that I can go buy unlimited and give as many of them to my dog as I want without any advice from a doctor or prescription, that doesn't have to go through the testing, right? That to me, it's like backwards.
I think that's above both of our pay grades as to what that answer is.
Yeah.
Okay. But yeah, it's what the rules are. So some of it's depending on, controlled drugs is a whole different thing with fentanyl or stuff like that, of course. But it just depends on the potency, the capabilities, and how it works. That's a really important thing is always to understand what is this actually doing? Like, oh, it blocks the pain. How does it do that? What's the contraindications? Those are important.
Okay. And then the last question was in regards to ACL surgeons. The wait times to get you guys is like crazy. So the question was, how long is too long to wait if I'm told that the lady wrote that their dog, I think, has torn ACL,
Mhm.
and they schedule the dog for 6 months out? Is Do you go try and go somewhere else? Is the dog in pain? Is it something that can wait?
It's a there's not a clear cut answer. Unfortunately, I wish I had one. Um, the less time we can wait, the better. That's always ideal. It's been hard because we added a whole bunch of pets to the population. We didn't add a lot of vets and vet techs, and so everybody stretched a little thin. Um, and these injuries are happening. ACL tear is the most common injury we see in vet med from a musculoskeletal standpoint. Um, in those time frames, you know, getting the dog to work on, if they're chubby, start to work on leaning them out a bit, walking them still. Don't put them on bed rest, right? I still want to be doing some stuff and using their muscles. The sooner we can get surgery, the better. But a lot of times right now, in some areas of the country, it's a 4 to 8 week wait. Sometimes it's going to be a couple of months, but it depends on what area of the country you're in, who can do it. But just because you can find somebody who may be able to do it faster, make sure they're still doing a call and that they know what they're doing. And they do. I like to do it right once the first time. I don't want to go back and have to do it again.
So do you see often? I know you go through this. I know it's happened to some friends of mine. The dog gets the injury. You give very specific. Gets the surgery done. You give very specific directions. How often do you see that person back? Like, hey, the dog got off the leash, was running around, re-tore. Is that common?
Um, Less in the last couple of years, especially with the TPLOs, because now we've gone to locking plates and screws, so it really binds it in there pretty well. But you still have to follow the rules. We have less setbacks with those. Sometimes the extra-capsular repairs, nothing against them. If they're done by somebody who does them exceptionally well, they're amazing. But if they're not done quite right, where those ones have a chance to tear, that's not designed to stay forever. It's there just to stay for a couple of months while the dog grows in scar tissue. So if you haven't given that chance to heal and that snaps, we're back to square one.
Very good. We're going to end it there. Thank you so much for your time. Thank you, everyone, for your questions. Really, I could talk all day with this stuff. I love learning about it. Thank you for taking the time, and hopefully we can get to the second half of these next time you're out here.
We'll do.
All righty.
All right.
Signing off.